really, if you think about it, no two human beings are exactly the same in their metabolic makeup and their physiology. Even if they're identical twins, there's likely to be major differences between how they're put together, right? And that's the same with buildings. There's no two buildings that are exactly the same. An architect could design the same exact building. They could be sitting side by side, and different things could be happening inside of those buildings independently of one another. So I think that both of you are absolutely right. You have to understand the baseline conditions. You have to take, based on that data and the science, you have to take corrective action specific to what you're seeing, and then continue to measure to make sure that those baselines are met.
Yeah. No, I wanted to emphasize that what Mr. Alan Wozniak and Dr. Ovidia has said earlier, that people get sick, building don't. But as we all understand now that there are two major factors for metabolic health and the building or healthy building. What are those two factors? Like in case of the individual, it is the genetics. But at the same time, genetics is one of the things which you can deep down more explore that what is wrong with that. But at the same time, the low hanging fruit is the environmental factor, which is obviously overlooked time and time. Because what is environmental factor? First of all, the factor which we have all air, water, and all the resources, that is like having some kind of parameter that need to be implemented. For an example, right temperature, right humidity in ideal world, right food. These are going to be one of the things which can make you healthy. But at the same time, like Alan was emphasizing, those environmental factor, including the moisture disbalance, including the various kind of particulate matters like PM 2.5 to PM 1, which is inhalable particle range, that basically work as a vacuum. So there is a lot of floating microbes that can be just adhere with those particles, and they are going to make entry. And like Dr. Ovidia was saying, that skin is the first thing which is continuously exposed. So that skin maybe due to the contact, you can have a lot of impact. And since the microbes tend to get morphological change, what we call the various kind of changes, not only one type of changes, and it can be just going to affect adversely to human health as well. So sometimes our body is very good system, but at the same time, outer factor, the environmental condition, make those organisms metamorphose or mutate or something like that, that is going to penetrate in your body, which your body is not capable of handling it. And especially those who are having a compromised immune system, or their immunity is not that strong, they are at a higher risk. So I would highly encourage that this environmental factor, which Mr. Wozniak was referring earlier, is one of the things. Like Dr. Ovidia takes some of the parameter from the human body to treat right. That's why the building condition can be treated only when you have those conditions met, meaning you have done some testing. Make sense?
No, it makes sense, Dr. Sahay.